Liberia has been declared Ebola-free May 9, 2015. The joy of a people that had already known more than 11,000 cases, 4,800 deaths, and nearly 5,000 survivors was short, barely 3 months. Indeed, on June 29th, a new case just has been detected in the province of Margibi. Instantly, a team is sent on site to understand and track down the chain of transmission. The investigation revealed that the Ebola virus was transmitted to a woman after unprotected sex with a male survivor. A man who had been declared Ebola-free from 199 days, almost 7 months. Once again, it is the lack of vigilant IPC which left the virus an opportunity to spread once again. Following this new case, the Redemption Hospital in Monrovia agreed to establish a unit for survivors.
Can you please, do that for us, Kevin, please?
The Dr. Moses is leading the survivor clinic, and it is essential for him to see his patients as regularly as possible in order to better understand the evolution of the virus. Some survivors are likely to suffer from post-infectious problems, and it is essential that the survivors are informed on IPC measures in order to protect themselves and others.
So I'm going to ask you some questions and then you tell me about your health problem, yeah? First of all, your full name is Rosie. We do not define IPC in terms of whether a patient is a survivor or not a survivor. We use IPC measures for everyone. In Liberia, we have more than 1,500 Ebola survivors from the biggest outbreak we've had. And after surviving Ebola, many of these survivors are having post-Ebola complications. Male survivors continue to incubate the virus in their semen and then can transmit the virus and cause EVD infection after unprotected vaginal intercourse. And then in addition to providing care for them, we sustain messages about infection prevention of control. We teach them how to keep safe and keep serving in their communities. We give them condoms to have protected sex. We encourage them to continue hand washing.
When the community decided to take ownership and to educate themselves and take the precautions that needed to be taken to prevent the spread of the disease. That, I believe, strongly was the turning point for us.
The Redemption Hospital has decided to go further in IPC measures and produce themselves clean hand sanitizer based on protocol established by the World Health Organization.
So you do titration,
yeah,
which is the correct method that WHO recommends.
We do
Very
titration
good.
and we do measurement.
So this is the kind of bottle that you distribute to each healthcare worker?
Yes, to each healthcare worker.
Yeah?
Okay, thank you.
Thank you so much for your work.
Thank you.
And congratulations.
We are much better than where we were 1 year ago, but we need to be even more in a better shape 1 year from today. Constant mentoring, supportive supervision. Despite the fact that we have made a lot of progress, there are still some gaps, there are still some lapses here and there. And again, WHO is working very closely with the partners, with the Ministry of Health, to implement a nationwide mentoring program to really sustain the positive changes that the health workers have adopted.
Take the other hand, right? We'll go 1, 2, 3, 4, 5.
These simple but essential gestures needs to be repeated again and again. Today is the health staff of a hospital who came to be trained to refresh their memories in order to do the right thing at the right time. All these health workers have been in direct contact with the virus, and many of them have lost families or colleagues. And for some of them, it is difficult to get back to work.
We noticed that it would take a while for them to gain the confidence to get back to their facilities, and so that was when the idea came to put them through this training, to give them the opportunity to learn the safe practices that they need to put in place when they get back, and also to have an opportunity to interact, to spend some time refreshing their memories, maybe get to share what they went through. The approach that the training has is a more integrated, holistic approach, which with several components like IPC, surveillance, psychosocial support for the healthcare workers and the patients, as well as some clinical components. And if you can see them, they're all very motivated and interested in the training and willing to go back to work. So their confidence is building up as they're learning these skills, gaining more knowledge and competencies.
We have taken these precautionary measures, and I am sure in Sierra Leone this will continue, because everybody is scared of getting anything, because we have seen the amount of our colleagues that have died and the amount of experienced, high caliber doctors that have died.
À asseoir définitivement l'implantation des précautions standards dans les structures de santé, je pense qu'on n'a plus à avoir peur des épidémies comme Ebola ou d'autres maladies infectieuses. Parce que rien que l'implantation des précautions standards, ça permet déjà d'éviter toute diffusion de maladies infectieuses. Les précautions standards, c'est la base même de la prévention des infections.
The lessons we learned in Liberia was the need to ensure core capacities for the international health regulations are built before a disaster of this nature hits the country. Indeed, by building those core capacities, by investing in building the core capacities of the international health regulations, countries will be able to better detect, better respond to any health emergencies of this nature.